Using a cane may become an important part of Rowan Goyne's daily life. He has macular degeneration, which has so far taken 30% of the vision in his right eye. It's one of multiple chronic conditions he's managing, including with a monthly visit to the GP.
So I spend a fair bit of time at the GP in a 10-minute appointment, which is only for one item technically, bringing them up to speed where I am with my relevant specialists.
The regular appointments alongside medications and treatments all add up for someone who says he's limited in how much he can work.
So I've delayed things sometimes, put some things off, scans and things like that, because just couldn't afford them, just couldn't even catch anything, just couldn't afford them at the time.
A visit to the doctor is less common for Lauren James. As a healthy woman in her early 40s, it only tends to happen when she's sick.
I think about the concept of checkups or preventative medicine, and maybe it's something I should do. I've never done it before. And now, to me, the cost is something that is stopping me from doing that.
When she first moved to Canberra from Sydney in 2020, Lauren initially found a bulk billing GP. But lately, that's proven elusive.
I could get in my car probably in Sydney and drive somewhere to find somewhere to access these services. I'm not sure about that in Canberra. I'm continuing to do my research.
Bulk billing rates in the ACT are lower now than before the pandemic, down from almost 2/3 of GP visits in the last quarter of 2019 to barely more than half in the last 3 months of last year, consistently below the national rate.
Today I announce that our government will expand the bulk billing incentive to cover all Australians.
The Prime Minister has pledged to triple the bulk billing incentive for non-concession patients and provide an extra loading for practices that bulk bill all patients, with a target that 90% of visits would be bulk billed by 2030.
There's a very healthy level of scepticism of GPs in Canberra about whether or not this would actually make any difference to the financial viability of general practice.
The government says its changes would triple the number of practices that bulk bill all of their patients, including in the ACT. Figures from the Health Minister's office reveal the number of bulk billing practices here could increase from an estimated 8 to roughly 25. But as a percentage, it's still much lower than what's expected nationally. Dr Kerry Ost says ACT practices have higher expenses in areas like insurance and some staffing costs, and some doctors couldn't recover from being forced to bulk bill more often during the pandemic.
What we found were that GPs were working longer hours to pay their mortgages, and many of them actually left in the years following.
Labor is already managing expectations about how effective its changes would be.
The government cannot force a doctor to bulk bill. What we can do is ensure that the incentives are high enough for them to make that choice, and that's what we're doing. So it remains to be seen what happens here.
Are the cost structures going to change? Probably not. Is it going to mean that there's going to be a reduction? I don't hold out a lot of hope for that.
A persistent expense some Canberrans can't afford to spare. Patrick Bell, ABC News, Canberra.